I'm going to talk to you a little bit about PFI and the Department of Health and the NHS. It turns out, once you look at it, that privatisation plans have been being pushed at us for quite some time. In fact, always the one privatisation plan. I've got a version of it here. Thank you. Yeah, pull that. It's called After the NHS by Arthur Selden. Arthur Selden was one of Mrs. Thatcher's policy people, and he was also director of the Institute of Economic Affairs. And then there was an extensive scoping phase during the 1980s in which various vultures were invited to come in and kind of scope out what they'd like to have come the carve up. And the Adam Smith Institute Health of Nations report in 1988 explained the plan in some detail. It explained all of the senseless reorganisations we've seen. And it touches on PFI. It explains that private capital could come in and help with hospital building. In 1992, Selden pops up again as the founder of DEMOS, the Third Way think tank, which people believe, for some reason, is of the people, because of its name, possibly, but it is not of the people, it is of the American corporations. So Arthur Selden was one of the 16 founder members, and so were a bunch of other interesting people, a load of bankers, a load of Thatcherite ideologues, a load of Thatcherite senior politicians, and interestingly, Chris Ham of the King's Fund, Professor Chris Ham of Birmingham University, and another professor at Birmingham University was also one of those 16 founder members, and that is Professor Sue Richards, who is currently co-chair at Keep Our NHS Public. Which is why Keep Our NHS Public is not doing a terribly good job generally from national level of mobilising support for the NHS. So Keep Our NHS Public activists are great, local groups are often great, please join in with them, but that's what's going on at the top. We have a PFI propagandist in there. Okay, so then the hospitals were incorporated as companies through the Health and Social Care Act 2003. They're called foundation trusts, and I've only just found out that they're all limited companies, so could be sold. They have directors, they are based on a business model, they're for profit, and their new managements recruited around that time are all on profit-related pay. So when they cut nurses' salaries, they increase their own bonuses. So that might explain to some people how Stafford Hospital's disaster happened. It was nothing to do with the traditional NHS, it was the new arrangements. PFIs were then being put all over our hospitals. As with most of the city's policies, they go cross-party. So they started in Major's time, but under Blair they really boomed from 2000. So as far as possible, hospitals, local hospitals, the big ones, the big sites were reworked as PFIs. In many cities, city centre sites were sold off, and the PFI hospitals were built on the outskirts of town. Maybe we've never owned those sites. We aren't able to see the PFI deals. It is very likely we are going to lose those sites if those deals are unwound wrong. There's all kinds of trickery involved, but we aren't allowed to see any of it because, of course, it's all commercially confidential and therefore secret from us. So in the early 2000s, we also had Blair in power. Simon Stevens, who now heads the NHS, after some tenure at an American insurance company, he was Blair's health advisor, and Professor Sue Richards was at the Cabinet Office. Health Act 2009 created a new route of privatisation for our hospitals. It never existed before because they're part of the public sector. It allowed them to go bust, supposedly, because as incorporated companies they now can. That's the reason they were created as companies. It set up the unsustainable providers regime with the special administrator, which will be a management consultancy, and some accountants paid from the public purse. And that is the mechanism, folks, which the coalition has been using to start to take down our hospitals. A couple of years ago, we saw the Lewisham court case after the hospital next door went bust, and somebody decided it would be a good idea to shut Lewisham Hospital, and the somebody was Jeremy Hunt, and he was stopped from doing that by a win in court. So he brought into the care bill a means to override that, because he is bent on privatising our hospitals A McKinsey report in 2009 called QIPP explains the plan is to privatise all of the PFI hospitals, which is about a third of them, and get rid of the rest for redevelopment. So now we're at the stage where after the care bill, the last obstacle is those PFI debts. They need to stay on the hospitals so that we can fight those PFI debts and deal with the situation. If they're transferred away, centralised into the Treasury, or as we've been pushed through KONP into local authorities, the last obstacle to privatisation is over. So what's happening at the moment with our hospitals? They are basically going bust. They're not paid enough for the work they're doing, and their contracts are being given out to private competitors who only pick the bits that they can make surpluses on, so they're being left with all of the difficult, costly work, too little of the money, and they are going down like nine pins. So we need to oppose this attempt to get off the PFI debts. What should we be doing instead? Well, we were told a pack of lies. We were told the point of this was to game the public borrowing requirements, their own rules, which they could have changed. For off-balance sheet financing reasons, that made no sense. A lot of us suspected that the point of this was to help their cronies to some nice little earnings, and of course that has happened, including founder members of DEMOS. However, most of us didn't see this as a planned privatisation, but once you look at the laws that have come in over the last couple of decades, it is very clear that this is all premeditated. The PFIs have not only been gouging us for decades, but this was a foreplanned arrangement in order to take our hospitals away from us. So what should we be doing? Well, it's interesting that several Tory MPs and McKinsey have actually argued that we should renegotiate those PFI debts to something reasonable. I've been arguing we should renegotiate them down to fair value. We certainly shouldn't be giving everything away to the PFI lenders by centralising the debts. And when you look at those contracts in detail, you can see that not only we were told a pack of lies at national level, with investors told about risk transfers, risks staying with the public sector, and we were told that all the risks would transfer to the private sector. So not only were we lied to on a national level, but when you look at the business cases used to draw up those PFI contracts, you can see that they are all systematically skewed so as to make the PFI deals look a lot better. And you also, there is a lot of research being done into the process into which those debts were put in place, and hospital staff had to be bullied out of their jobs in many places in order to get those deals in, because people could see that they were an absolute disgrace, a gouging of the public purse. So that's the story of the NHS and PFI. This has been a premeditated attempt to get rid of our hospitals. The reason is that the American health industry does not like our hospitals because they are competition, which takes away British people's interest and fear of health damage and interest in paying for health insurance. And unfortunately, folks, that's the story of what's happening to the NHS. Thank you.
Anyone have any questions for Lucy?
Can you just smile this direction for a minute?
How many GP surgeries have been shut under the system?
Well, in terms of GP surgeries being shut, that has been happening. There was an interesting case in Camden where a GP surgery was put out to tender the existing incumbents. There'd been GP services there for 100 years, but unfortunately Camden decided to turn down their offer and to take on United Health, the insurance company for which Simon Stevens of the NHS formerly used to work. And they found they weren't making any money out of it after a couple of years, so they passed it on to another subcontractor who decided after another year, when they didn't make any money either, just to shut the thing. It turned out that because the subcontractor had got no contract with the council and the CCG, nobody could do anything about that. The whole thing was unpremeditated. The contracts weren't written tightly to protect us against that, and 4,500 people ended up with no GP. So some of them ended up having to go 5 tube stops away up to Highgate to find an alternative, which is obviously not very satisfactory if you're ill. We're also seeing a lot of outsourcing of GP services which are being run down. So Virgin have got 1 million patients under GP services in the north of England. We're seeing out-of-hours services being cut to the bone. One outsourcer down in Cornwall thought it was sufficient to have 1 GP on for the entire county overnight. and that did not then require that GP actually to be in the county at the time, which is clearly unsafe. So at the moment, we're seeing some attrition to GP surgeries, but actually what we're about to see is United Health taking over GP budgets from underneath, and indeed the hospital budgets as well, because those are now allocated via GP services. So the clinical commissioning support groups fronted by GPs don't have the skills in them to actually do the contracting work. They do everything through commissioning support units, and those are about to be privatised. A researcher who is more canny than most has looked into the ownership of the companies they're about to be privatised into the hands of, which are, a various disparate bunch of names. But when you dig into them, it turns out that they're all actually United Health in some guise or another. The Labour Party has been trying to make those legal through the backbencher bill, the EFFORD bill, which I call the United Health Private Monopoly Bill, because it will make that arrangement legal, which the Coalitions Act made illegal. So we are going to see basically an insurance company taking over our GP services money from underneath, and at that point we will start to see things changing. The integrated care model that's being pushed on GP services will be denuded of doctors very largely. There'll be a lot of online stuff, there'll be a lot of chatting to healthcare assistants probably, but insurance companies don't use actual qualified doctors except in the denying claims process. So in the end, our GP services will be much more like an insurance service capture, and they won't really involve actual qualified doctors so much.
Is there an example somewhere else in the world where the health system is horrendous because it's totally co-opted by private finance? And can we? I mean, like the whole series, Breaking Bad, was all about someone that couldn't pay for their own health, so he started making and selling drugs. That was all about the Health Act. So, yes.
Thank you for bringing that up. Yes, of course, that company is over the water. We know that this is kind of a sensitive point, because whenever you start digging, that's what you see, that it's actually transatlantic interests. Some German interests, a lot of banking interests, but also various US industrial interests backed by their government. So that's the situation. Things are a disaster there. People were told that Obamacare was going to fix everything. But unfortunately, what Obamacare is actually is another big subsidy to the insurance industry, and this time it's partly out of poor people's pockets because everybody has to buy health insurance. Not health insurance they'll actually ever be able to claim anything worthwhile on, but they have to pay for the health insurance, so that's what Obamacare turned into. Another country I would like to discuss very briefly is Slovakia, which had a gung-ho neoliberal government and then somehow managed to get rid of it. Perhaps we should take some tips from them on that. So they got a government which is prepared to try and renationalise, and it promptly renationalised their health insurance scheme because they didn't have our previous cost-effective arrangements. Under Bevan they had social health insurance, and that had been privatised. So the government said, I'm sorry, our health insurance scheme is going to be run for profit now. They were sued by a Dutch company which was involved about its loss of income, and that company won, and the Slovak government had to compensate it quite a substantial amount of money. And then most recently, in this week's BMJ, I've managed to get a report in there with Professor Martin McKee also on what's happened in Slovakia most recently, which is that an Austrian bank which invested in a Slovak health insurer, so it's an indirect investment, they took the Slovak government to court. And in principle they would have won. There was a technical irregularity in their case. But now we see what happens if you allow privatisation to go through as we have under the coalition, and then allow a trade treaty into place that controls it. It means you lose control. Now over TTIP, one of the points I was trying to make in the BMJ is that we've had all sorts of insurances from EU officials, and we've had them from our government officials, we've had them from Cameron, we've had them from Cable, we've had them from everybody in the dog actually. But in the Slovak case, the Trade Tribunal made perfectly clear that EU officials didn't have the last word on anything, and neither did national government ministers, that the Trade Tribunal is a law to itself. If you open the door to it, it takes control. So that's what we're seeing in terms of international examples. We see our fate over the water. That's where we're supposed to be heading, costs 2.5 times as much. spends about a third of that on running a market and fails its population in terms of life expectancy and infant mortality.